Hi, I'm Dr. Yuval Bibi. I'm a board-certified dermatologist, and I'm on a mission to help people get over their sensitive, dry skin and live their lives free of distraction. Now, let's talk about dry, cracked, thickened skin feet. Those are also called plantar keratoderma. That is a very common problem. Calloused feet, thick skin, cracked skin, painful to walk on, hard, and very difficult to get over. In this video, we'll crack the code on dry, thick skin feet and see how you can take care of your dry skin feet today. So dry, thickened skin on the bottom of the feet, otherwise known as plantar keratoderma, is a very common problem, which can be caused by many different conditions. First, genetics. Genetics are a very common cause of plantar keratoderma or thickened skin on the feet. A first good clue would be that you have family members who are suffering from the same problem. Your mom's suffering, your sisters or brothers, maybe your dad, maybe aunts or other relatives. That is an excellent first clue that this may be a familial problem. However, you cannot change your genetics or your family's genetics. You have to stick with them. And besides, why would you want to change your beautiful mom into something she's not? You have to stick with the genetics. But as you'll see later on, the approach that I'll be giving at the end of the video will actually help you deal with dry, thickened skin, even if it runs in the family. Even if your relatives have it, you will be able to deal with your dry, thickened skin better off than you were before. Inflammatory conditions such as psoriasis or dermatitis of the feet can lead to dry, thickened, cracked skin of the feet, and obviously dealing with those conditions is something of the utmost importance. Skin infections such as tinea pedis or athlete's foot or fungal infection of the foot, as well as pitted keratolysis, which is a bacterial infection of the feet, which leads to dry, cracked, and very stinky feet, are both infections of the foot that must be treated to get over the hump of dry, cracky, thickened skin on the feet. Warts or verruca plantaris, especially when involving an extensive area of the foot, can lead to dry, cracked skin on the feet, which can be very painful. Certain infestations of the skin like scabies, especially what's called Norwegian scabies, which is scabies that may have been treated erroneously by steroids, making the problem worse, can lead to dry, cracked feet, amongst other issues of the skin. This is not limited to your feet, but can definitely be a problem on the foot area, making your life very, very miserable. Some medications may lead to dry, thickened, cracked skin on the feet, such as hydroxyurea, for example, and certain types of cancer. For example, Sézary syndrome, which is a subset of cutaneous T-cell lymphoma, can lead to dry, cracked, thickened skin on the feet and can be part of the complex of dealing with that type of cancer. Keratoderma climactericum, which is a form of dry, thickened skin on the feet, is a condition that affects postmenopausal women whose estrogen levels are low, and that can be a serious problem leading to problems with walking with significant pain over the foot area. And then there's skincare. Good old-fashioned skincare that can be very abrasive, highly sensitizing of the skin, and leading to callousing and thickening of the skin as a reaction to exuberant, overenthusiastic, and aggressive skincare by abrading the skin using hot water, using detergents on the skin, using all sorts of physically abrasive devices on the skin. All those can lead to worsening of your condition and thickening of the skin over the affected areas. And then there are pedicures. Now, I know this may sound counterintuitive because the pedicure technicians are buffing and scrubbing the skin away, maybe using a pumice stone, which you may be using on your own, and they're doing all these backflips to get the thickened skin off your feet. Keep in mind that overtly aggressive pedicures can actually lead to callousing of the skin in reaction to the aggressive practices implemented by the technicians, and that could be one of the reasons why you're not getting over your dry, thickened, cracked feet. Now let me know in the comments section, are you suffering from dry, thick, cracked skin on the feet? What condition do you think you have that's causing it, and how have you been able to address it? So how do you treat dry, thickened, cracked skin on the feet? Well, first, as always, do no harm. Avoid abrasive practices that are keeping you stuck in one place and keeping your skin thickened, reactive, angry, and more sensitive. That means you have to give up soaping and detergents all over the feet, which are making the skin worse, stripping off the upper layers of the skin, making the skin clamor for more of those upper layers, possibly reacting and producing more. Avoid physical abrasives such as the pumice stones, the scrubbing, the exfoliation, the brushes, the loofahs, the filing. Any one of these practices, if done frequently and aggressively, can actually lead to worsening of your condition and thickening of the skin over the affected areas. Also, avoid aggressive pedicures. I'm not telling you to avoid pedicures altogether, but get to a middle happy medium with your pedicure technician. Tell them to take it easy on the feet, not exfoliate or scrub the skin as aggressively as they would regularly, and that will get you some relief, maybe even better looking feet if they do their job and they do it gently. Second, address the underlying condition that's leading to the thickening of the skin, if there is such a condition. Now, the majority categorical cases of dry, thickened skin are usually done to a combination of genetics and maybe external environmental factors. However, if there is a chronic condition that is leading to your skin being thickened, dry, and cracked, address that condition, often with your board-certified dermatologist. So if you have an infection of the foot, such as tinea pedis, or pitted keratolysis, see your dermatologist. If you have psoriasis or eczema on the feet, see your dermatologist and address your condition effectively. If you're using any medications that can be stopped or the dose can be lowered, talk to the physician who prescribed the medication, such as hydroxyurea, and see if there's a substitute or a way of lowering the dose leading to less of a problem as far as your feet are concerned. If you're having an infestation such as scabies, obviously it's time to treat that infestation. Get rid of those mites and get rid of that dry, thick, cracked skin. If you have cancer, obviously see your board-certified dermatologist and work in collaboration with oncology to rid you of that thickened skin over the feet. And if you're a postmenopausal woman or woman who suffers from low estrogen and are suffering from keratoderma climactericum, you may need estrogen treatment, either topically or systemically, to rid you of those dry, painful, thickened skin feet that are preventing you from walking in peace and getting around. Third, employ great skincare. I cannot stress how important is great skincare for the health and prosperity of the feet. So obviously avoid doing any harm to the feet by abrading them and keeping them stuck in their callousing hamster wheel. However, you can actually make things actively better by adding protection to the skin and allowing it to catch up. Specifically, rinse the feet with lukewarm water or even soak the feet in lukewarm water, making the skin more moist and plump. Then focus on moisturization. Moisturization goes a long way, specifically moisturization with moisturizers called humectants, such as ammonium lactate, lotion, or cream, or better yet, Urea 40% cream, which is now available on Amazon over the counter, or you can get it through a prescription by your dermatologist. Applying that moisturizer consistently to the foot at least twice a day, especially at nighttime, is a very important first step in getting rid of your dry, thick, and cracked skin of the feet. So apply the moisturizer aggressively. You may need to apply it several times a day in the first steps of turning your skin around. So be hyper vigilant about applying that sort of moisturizer to help soften the skin and bring it back to normal. Also, if you want to take the extra step, apply an oil-based moisturizer over the humectant to seal in all the juices and make matters even more plump and softer as the end result. So use moisturizers such as petroleum jelly or Butter Oasis Moisturizing Balm, our vegan 3-ingredient moisturizing balm made with organic edible ingredients, shea butter, cocoa butter, and argan oil. Apply this moisturizer thickly over the feet, over the areas that are suffering over the humectant, to bring yourself even more relief and pick up the efficacy of your moisturizing efforts. You want to go even further? Occlude the moisturizing mix over the feet at nighttime with either saran wrap, plastic wrap, or socks to make sure everything is bundled up and sealed in, allowing the moisturizers to stay on the skin and do their job in protecting the skin, allowing the skin to turn itself around and start producing healthy, normal upper layers that'll protect it with longevity and turn your skin around. So moisturize, rinse, repeat, and you'll get your soft, plump skin back in no time. Be sure to give this technique a few weeks to work. Be patient with it, and at the same time, pay attention to the time frame, because if you're not improving with these very aggressive measures, then it's time to go to number 4, which is to see your dermatologist. Now, there are a few cases of plantar keratoderma which, despite very aggressive moisturizing measures in avoiding of making things worse with aggressive skincare do not turn around as desired. In these cases, a board-certified dermatologist may need to take another look at your feet and see what's going on. So again, if there's an outstanding skin condition or otherwise any condition that needs to be addressed, that'll be addressed by your board-certified dermatologist. And also, if there's a need to go a step further, there are some medications that can be administered by a dermatologist that could turn your thickened skin around. Specifically, medications in the class of retinoids, isotretinoin, otherwise known as Accutane, or acitretin, which is isotretinoin's brother or cousin. These medications can turn thickened skin on the feet around, usually after a few months of treatment. So those medications may need a few months or even many months to work, but they could do magic to your feet if you're persistent and motivated to turn that thick skin around. So to summarize, dry, thickened skin on the feet is a very common condition that could be stemming from a variety of causes. The first step to address your issue is first, do no harm by backing away from any practices that are making your condition worse. Then address any outstanding conditions that may be driving your dry, thickened skin. Do it with the help of a physician and treat your conditions to make sure they're not compounding the problem. Third, practice great moisturizing skincare using humectants and occlusive moisturizers like Butter Oasis Moisturizing Balm. And fourth, if your problem is not turned around, see your board-certified dermatologist for additional evaluation and possibly medical treatment of your condition. Let me know in the comments section how you're planning to turn your dry, cracked, painful feet around. And if you've done so already, I'd love to know how you've done it. If you've enjoyed this video, don't forget to give us a thumbs up. Also, don't forget to subscribe to the channel and share this video with your loved ones. For more information about skincare scam shenanigans and tomfoolery, don't forget to pick up my book, 6 Skin, Skincare Made Simple on Amazon.com, now available in audio. Thanks for watching. God bless.